Hi, I'm Jaden Grimm, and I'll be talking about opioid prevention in other countries. We'll be talking about Canada's strengths and its weaknesses, Australia's strengths and weaknesses, Scotland's strengths and weaknesses, my plan, and I'll just say the references. Canada's strengths, to control the opioid addiction rate, they believe in a stronger border and have formed acts like the Stronger Border Act. They have spent over $750 million to their substance use and addiction program, which uses medication-assisted programs and reduces stigma. And they have also programs for veteran homelessness, youth mental health, and youth substance use prevention, which is really cool. Very nice. Canada's weaknesses may include their border in general. Because of the drug trafficking that's going through really bad, they need to strengthen their borders, and that's why they are joining the America with the Northern American Joint Strike Force to reduce fentanyl trafficking, and they're also trying to work on money laundering, so that they're targeting them specifically. Australia is developing their program right now, and they are trying to look direct to patient education programs, so they're working more on the education part of things. And the website that I looked at specifically kind of made me laugh, because it said America's opioid crisis is one of the most significant public health catastrophes of our time, and Australia has made a concerted effort to avoid this level of detrimental damage. And although the opioid epidemic is horrible in America, I would like to think that I don't know if it's the most catastrophic public health of our time. I think I could think of a couple others that were pretty negative, but at least they're taking notes from other countries. I would say the weaknesses would be that they're still developing, and they are mainly using education-based programs, so that's on the patient to stay educated, and if the patient chooses not to be, then they're more likely to be addicted, and it might not be as efficient as maybe Canada's. Out of all three, I thought Scotland's was really, really good. It focused on harm reduction and uses naloxone, safer drug consumption, drug checking, and treatment like what we have. And they analyze how opioid affects small groups, specific groups I should say, like the workforce, and they're really big on collecting data and surveillance to increase knowledge and how to battle this. I think what they're doing is really, really good compared to maybe some others. And it is difficult to compare America and Scotland to each other because Scotland is such a small country compared to America. So that's why the fight against the opioid crisis requires lots of surveillance and government intervention, which takes money and people to get it done. For a smaller country, that works, but for something as big as America, it might be more difficult to really target down where our issues are. My plan is inspired by all three, including America. I do think that naloxone is an integral tool that we need to use to fight the opioid addiction, and it should be used more widely and be made more available. We shouldn't be aiming to make money off of this. It should just be available for anyone. I would like to broaden the types of treatment that we offer. I like holistic choices, but I think pharmaceutical is also just as necessary, so it would be cool if we could get it more person-to-person based and not just one program fits all. I would like to also start education with younger audiences in schools, make them evidence-based and not kitschy and funny, like the egg yolk thing, where like this is your brain and this is your brain on drugs, and they scramble an egg. Like that's just a silly haha thing. I know I would like to have, just for drugs in general, classes on what they do, how they affect people, and long-term effects. Make them realistic and scary and just not something that people want to encourage. And like how can opioids used in a good way, in a prescribed way, and how to avoid addiction. I would also like to target prescription guidelines and make them a lot harder to get a hold of Like, this needs to be like the last option possible, just because of how addictive opioids can become. And I would like to continue the making finding help less stigmatized. Like, we should never find someone like we should never view someone more negatively if they are looking for help. That should be encouraged and applauded, honestly. And then these are my references. I looked at all 3 countries just to see like what their information was. And thank you. I appreciate it. Have a good one.